Asian rhinoplasty has undergone a lot of revolution over the years. Back about 10-20 years ago, Asian rhinoplasty was considered just an augmentation rhinoplasty, where the goal of the rhinoplasty was to overall just increase the size of the nose. And in the past, we used to just put in a silicone implant, an L-shaped implant, so that there's an extension of the dorsum and there's also an extension of the columella. But now we know that just like a reduction rhinoplasty, that anatomy is so essential in Asian rhinoplasty. So now what we do is that we augment the dorsum separately, and we define and augment the tip in a separate anatomical unit. For a lot of people with real necessary augmentation of the dorsum, we still use silicone implant. I like the silicone implant because it truly gives a nice anatomy to the dorsum of the nose. In people who need just a slight augmentation of the dorsum, I like to use a material called Gore-Tex along with Alloderm, which adds a little bit more of a subtle look, more of a natural look to the dorsum of the nose. For the tip, I think the key is always making sure that there is enough foundation underneath. So the key thing with the tip is to augment and strengthen the columella first. And the way we do that is with a cartilage. The first choice of cartilage that I like to harvest is the septum. And from the septum, we put what we call a columellar strut. And what that does is that it provides a nice support and a foundation for the tip blast to be conducted. In some people, though, the columella and the septal cartilage is very small, in which case we harvest the ear. So this is what we call the auricular cartilage, and we utilize that to define and augment the tip.